Okay, welcome to our Careers in Public Health series. This is a series where we ask people working in different public health professions to come in and talk to us a little bit about what their careers are, what they do, any tips or advice that they might have for us when it comes to discussing preparation. Hey, Nina, mute yourself. When it comes to preparation or tips for the field. So, is there something kind of new coming up? And really just to answer questions that you might have about their career path, about your own career path. Anything like that is open for discussion. So I think what we'll probably do now is let's go ahead and I am going to introduce our first speaker. This is Jared Opsal. Thanks for being here. He is the Executive Director of the Missouri Coalition for the Environment. And we're really happy to have you here, Jared. And I think I'll just turn it over to you.
Yeah. All right. Thank you. Thanks for having me. Yeah, I guess, so should I just jump in and give an overview of our organization, or do you want me to give like my personal professional experience from after graduating?
I think they're going to want to know maybe like a little bit about what the organization does, but then probably more about sort of how you got to what you're doing right now.
Okay. Missouri Coalition for the Environment has been around since 1969 in the state of Missouri as an environmental advocacy organization. So what that means is individuals got together and they decided that they needed to have an independent voice for people's health and the environment in the state of Missouri. And they, did that at a conference actually in Missouri Botanical Garden that was being held. And that's where they first announced it and started gathering people together for this. There's been a lot that's been done by the organization since then. But I think it's always interesting to note that they came together and started this before the EPA existed, or before the Department of Natural Resources in the state of Missouri existed. So this was before any of those, I think, standard government regulators and regulations and policies were even in place. They were recognizing the need for advocacy and for people's voices to be heard by their elected officials. And that's really been at the core of what the organization has done over the many years it's been around. So just to give an example of some things that we're engaged in currently, and I'll try to focus it on some geographic areas that are close to us in the St. Louis region. So one of them is the hazardous waste issue in North St. Louis City and North St. Louis County. There is, if you weren't aware, radioactive waste in a watershed that runs from roughly the airport up to the Missouri River. It's called Coldwater Creek. There's also quite a variety of other hazardous materials in that watershed as well, such as PFAS, which is forever chemicals, which can be cancer-causing agents, heavy metals such as lead, and there's jet fuel runoff. I mean, there's all sorts of awful things in this watershed. The most notable being the radioactive waste. And if you weren't aware, that really stems from World War II, of all things. It's been around for an extremely long time in our region. St. Louis is a site for refining uranium for the bombs that were created for World War II. And they never properly disposed of those materials. And it's literally been out in open air for runoff and for wind-blown drift to be contaminating communities and watersheds like that one ever since. So we've been really engaged on really whistleblowing with that. Been engaged with the EPA as well as the Army Corps of Engineers to focus on the regulations around cleanup and informing people. So that's been a really big issue that we've been a part of, as well as every now and there's an opportunity for legislation addressing it. We really focus on the environmental justice component of it, which is really focusing on people and how they're impacted, and especially communities of color and low-income communities, how they've been impacted by it. So legislation that would provide compensation for medical benefits for people who have been impacted by that waste. Simple things such as just notifying people if they live in an area that was once contaminated or suspected to be contaminated. So because a lot of people just don't even know it's there. So that's one example. What that looks like is door knocking, canvassing, speaking with elected officials on a regular basis, getting media outlets to run stories on the issue, connecting with government agencies on the issue and working through things, submitting a lot of Freedom of Information Act requests and going through government documents. So, all with that focus on people's health and the environment. So that's been a big issue for quite a while, still a really big issue for us. We have one dedicated staff person to that, as well as some of our policy staff who help do some research, and interns who help out as well. I think actually someone from the class already reached out and was asking about internships coming up for the summer. So we will be posting those soon. Other thing that we do in the St. Louis region, I think would be helpful for you to be aware of, is a program called Known and Grown. It is, this is actually, I'd say, our happy program. Usually we're going after and addressing some things that can be depressing and just really heavy and big problems like the one I just described. This one is much more positive in nature. So what we do is we go around to farms in the St. Louis region, and we conduct audits on those farms to certify them for a whole wide variety of eco-friendly practices. And if they pass, the different requirements we have for the program, then we, give them that certification stamp. We enter them to the program. Then we start offering them all sorts of resources. We can offer mentorship to help with their businesses as well as their farming practices if they want to improve and do other things on their farm. We offer them PR support as well as marketing support. We do connections from farms to points of sale. So think of farmers markets and restaurants who want to sell, purchase, and then create products from local farms. So we can do this whole business component to it also. So that's a really fun program because, we got into it because of the environment, of, the impact of how we grow, process, distribute our food. It has a major impact on air quality, water quality, as well as people's health, what kind of food they're getting and where it's coming from. So that was really our why, but then, we quickly realized all these other issues overlapped with food, from food access to that small business development. A lot of the farms that we engage with are from BIPOC farmers and first generation farmers. So they needed, a lot of them didn't have like generational knowledge that was being passed down of what to do on a farm, and especially a specific piece of land that they're attempting to farm, of what happens on that land. So we have a farming expert who guides them through all those types of questions they might have. So it's kind of a fun program because it does so many different things. And I joke it's just as much a small business development program as it is an environmental program. But we recognize that it had to be, because there's just a simple truth of, if they're not successful in their business, it doesn't matter what environmental practices they put in place on their farm. So we have to make sure that they've got that leg up and getting that extra help so that they can be successful there. Other, I'd say, just common things that we do. I mentioned the advocacy. So we are in Jefferson City quite a bit, being Missouri focused. That's the state capital. So we work with state level elected officials quite a bit, as well as state level agencies such as Department of Natural Resources, who oversees a lot of things related to the environment in our state of Missouri, as well as sometimes Parks Department, which is a kind of underneath DNR, and Department of Conservation and different groups like that. Every now and then Health and Senior Services, although a lot of times they kick responsibility for that over to Department of Natural Resources, which is kind of interesting when you get the inner workings of who wants to take jurisdiction over different things, even though you can make an argument that they both could, or maybe one over the other, but that's kind of how it goes. So we have staff in St. Louis. Most of our staff is here. We have one staffer in Columbia, Missouri, and then another person out in Kansas City. So that's kind of the overall reach of the organization. There's 10 of us total. I mentioned interns. We usually have at least 3 interns every semester. We do them by college semesters. I think we're actually looking at about double that though going forward. We were just talking about different needs. We have policy interns, we have community outreach interns, and then we have kind of more development related interns. So people that would help us with membership engagement and events and that kind of stuff. So there's the overall landscape of the organization I'm currently leading. I joined 2 years ago. I just, like most people, I just saw the job become available. I applied for it because I thought it was a really good fit with my background and my interest. And here I am. They hired me, and I've been there for the past couple of years. After graduation, so this was back in 2009. I graduated with, at the time, it was a health education degree. And I know it's since just become more of a broader public health degree, which I think is great. But with my health education degree, I ended up getting a job with a small nonprofit that was housed out of St. Louis University. It's called Tobacco Free St. Louis. And I did a lot of public engagement as well as engagement with elected officials around tobacco policies in the St. Louis region, and working on campus policies for K through 12 campuses, as well as college university campuses. So I think just about all of them now have tobacco-free policies on campus. So no tobacco usage is currently permitted on a lot of these locations, which is a big project that we were engaged when I first started. And from there, I moved over to a group that is now called Prevent Ed, and they do a lot of drug and substance use prevention work in the St. Louis region. I worked on their opioid campaign for quite a while, doing a lot of public presentations again, as well as working with elected officials on some different state legislation that would help address the opioid problem in St. Louis region, as well as really the entire state of Missouri. So again, that advocacy component was a part of it. And from there, I helped found and then worked for a group called the St. Louis Downtown Neighborhood Association. And that was really community organizing and advocacy rolled into one. And that was my first movement into more of a leadership position. And I just, fell in love with that work because it was a little bit broader, and it was where I lived, which I think was also what allowed it to be much more of a passion project. So I did that for a handful of years. And after that, I went into fundraising. I ran an organization that raised funds for other nonprofits that was called Giveable. And then I quickly realized I liked the advocacy and raising hell. Being that one that's, poking an elected official on the side about an issue, or going to media and trying to raise awareness about something really important. And that's where, I landed with MCE, Missouri Coalition for the Environment. So came back to the advocacy world. It's been, I'm glad I came back, because it's a lot more fun over here than just raising money. It's great you're helping raise money for other people to implement, but
I'm like imagining Aaron Brockovich here, like
yeah,
or something like that.
There's a little bit of that. So I didn't mention we're kind of the group in the state that will litigate over issues too. So we are currently engaged in, I think, 4 different lawsuits, as well as 1 consent decree. So it's, as long as they keep doing what they're doing, it will continue. So there's 2 lawsuits against the EPA, which usually surprises people. So that's our independent nature. The EPA was not following the rules on the books for things that they should be regulating. One is related to secondary lead smelters, so they weren't regulating the air and emissions coming out of them properly. Another one was hazardous waste combustors, doing the same thing. They weren't regulating the air coming out of hazardous waste combustors, which, again, you ask any person, you would think they'd probably say, yes, we should regulate that and make sure that stuff is not getting out in the community and impacting people. And like that environmental justice component, it dramatically impacts low-income communities and communities of color. They bear the brunt of a lot of these facilities because their communities have, they reside right next to them, for many usually racist reasons. Those facilities were built there. My daughter just came home from school, so that's what she was calling to me. But yeah, so there's that litigation component too that we're engaged in, and we kind of have a few different public interest law firms who help us with that. One's based out of Washington University, and another one is called Great Rivers Environmental Law Clinic. So yeah, we have lots of partners that help us accomplish a lot of the things that we do. So I think I just threw a lot at you guys. Probably the better part would be for you guys just ask me questions, so I don't feel like I'm just randomly blabbing and not.
Well, I'm
providing any useful
guessing if
information.
they're thinking what I'm thinking, which is this is so much more broad. Are you guys thinking the same thing? Like, wow, this is like you've got pieces in everything. And I love sort of the social justice issue there with working with communities of color or low income communities, because, you know, that's definitely something that I know the students are aware of, you know, in their, they have an environmental health class. And yeah, it's really helpful. Okay, this is great. Okay, you guys, questions for Jared about his job, sort of his path, how we got there, what kind of person would be good for this sort of work, any of those questions or whatever. You can put them in the chat or you can ask him.
I just had a quick question about his opioid experience because I'm doing my project about that, and I was just wondering, like, what are some turning points that you guys may have made during your time over making an intervention and trying to like improve the rates of opioid use in Missouri?
Yeah, I know a couple, thinking of the legislative side, a couple things that we were pushing at the time was what was it called? It's a 911. It's funny, my wife's here and she works for that agency now. I should just have her come over. But it's a 911 bill that would allow people to call 911 and then not be prosecuted for possession of small amounts of an illegal substance. I know that was something that we pushed when I was there, and it did pass like right before I left, which was nice. Another thing that didn't pass when I was there, but we were pushing and then passed later, was a prescription drug monitoring program. So that was to help stop pill mills as well as stop people from doctor shopping, to help, you know, kind of have that early intervention. And again, it wasn't punitive in nature. It was to identify and then stop, and then hopefully that physician has an opportunity for an intervention there. The other thing, you know, we did at the time when I was there, a lot of it was just awareness raising, because it was people didn't know what was happening. You know, they just randomly hear a story of someone in their school who passed away from an overdose. And so that was the big piece when I was there. And then since, I know they've really moved more to that intervention and prevention stage of, all right, what are some other things we can do outside of the legislation I mentioned? So I know they do a lot of in-school programs as well as community programs, working with community coalitions. But I think I would just recommend certainly reaching out to that group, Prevent Ed, if you wanted to learn more about it. I think they still have some people dedicated to that issue.
Thank you.
Yeah.
Haley, did you have your hand up earlier?
Yeah, I did, but it was about the Prevent Ed and I didn't realize it was still up. But I also wanted to ask, do you just have your bachelor's degree and then you just had this experience and then worked up to where you are now?
Yeah, so graduated with my bachelor's in 2009, and I started working after that. While I mentioned how I was a nonprofit housed out of SIUE, because it was right there, I started picking away at my master's while I was working full time. So I started off with looking at a master's of public health degree, and I think I took maybe 9 credit hours in that area. And then as I was kind of thinking it through, I decided I wanted to be a little bit more broad and flexible. And that was kind of something that feed into me, because originally I was going to be a high school teacher, and I was certified in health, biology, and some other social sciences. But because of that public health background, that allowed me to land the other job when there were no teaching jobs available at the time. And so that really stuck with me of, well, let's stay flexible and get maybe look at a different master's degree besides public health. And that's where I landed on public administration. So I switched programs within SLU. And when did I think it was 2014. I finally graduated with my master's. So I just kind of kept picking at it like 6 hours a semester or so while I was working full time. And that's really served me well, because I liked that idea of being more flexible. And it's kind of funny. It's like that butterfly effect. If certain things didn't happen when they did, would I be a teacher right now as opposed to doing what I'm doing right now? And I have absolutely no thoughts of ever wanting to go back and be a teacher now. I mean, I just really fell in love with the community organizing and advocacy work. But I would have never known that if I just didn't happen to, get the job I did when I graduated. But yeah, that's why instead of going public health, I went public administration, because I knew I wanted to move into leadership, and I wasn't quite certain if I wanted to stay in the public health realm at the time. Obviously, I'm still in that public health realm, but I just wanted to give myself a few more options, because I hadn't made up that mind for myself. And I know some people are great and they know that path. Like my wife, she knew that path from undergrad and graduate school for public health. I was not that person. I was a little more indecisive.
Thank you.
Can you talk a little bit? I'm glad to hear you talking about public administration, because I think we do have students who are sort of interested. Definitely. So we have students interested in like healthcare administration, public administration. We now have an MPH MBA combined program at SIUE. So sort of those. Can you speak a little bit to like, what is public administration? Like, how is that unique in that sort of group?
Yeah, it really focuses on organizational theory for nonprofits and government institutions, as well as how policies are implemented, from start to finish. So I found it really fascinating, because you got to better understand inner workings and why things are structured a certain way, as I think there's a lot of complaints about how government is structured and why things can take a long time, maybe making an information request or other things. And there's some real accountability reasons why it's built in a certain way. So they can really dig into that, and also just kind of leadership management that's built into the program as well. But with the one I took, and I'm not sure, I can't speak to how they all are, but the program I was in, you have like those electives within your master's program, and I had some in the public health, and then I was able to choose some other ones and there's a social policies class that I took, and there's where you could dig in more on why healthcare is the way it is in our country. And that was really fascinating for them to be able to dive in and learn more about that. So I kind of describe it as a little bit of like a jack of all trades master's degree, because you can really be very broad with the different electives, and I think also the different opportunities post-graduation.
It's interesting. Usually we have somebody who's going to ask this question, but if you guys aren't, I will. Do you have a sense of, can you give a sense of sort of entry-level jobs getting into the field of environmental health or into a similar field as yours? What are you seeing like in terms of like salary ranges, and then what's the trajectory, with more education or more experience? What's the living like basically in that field?
Well, I would say generally you can probably expect to start, and we're a little different. So depending on the position, we don't require a bachelor's degree. Some we do, some we require more if it was a little bit higher up. But I would expect low 40s for entry level. And then it just goes up from there. And I would say kind of based off of merit and experience. So for example, we have an employee who does not have a bachelor's, but they have a lot of lived and volunteer experience on some of the issues. And, we treated that as that education. And we brought her in at a higher level because of that. So she had almost like consider like an apprenticeship for the issue that we were concerned about. I'm not going to say that every organization does that, but I would expect salary ranges. You would, for our area, it's easily in the low 40s to, your very first job just starting out. And that's for, I would say, 501c3 nonprofits. So there's different types of nonprofits. There's the ones that do more direct lobbying, like Sierra Club. Like they would be a similar one. So they're the ones that can actually pick a candidate and say, vote for this candidate. We can't by law do that, and we don't do that because that's not who we are. So there's kind of two purposes there, but they can pay a little bit more because they're getting different types of funding that comes in for them, and they have that ability to do that. But that's a very different type of job, and they won't give you that public service forgiveness loan. You can't do that through that type of employment. So if you're thinking like, if I'm on that program, the public service loan forgiveness program, if you're thinking about that, it's got to be a 501c3 nonprofit, or it's got to be a government agency. So I think most people are starting to understand that, but I think it can be confusing sometimes if they say, oh, nonprofit, but yes, they are technically a nonprofit. They're not the right kind of nonprofit to benefit from that program.
That's good advice. I hope you guys are noting that down, that if you are looking at student loan forgiveness. So 501c3 are the ones that can grant that, or that you can apply for that. Do you have a sense of like who does well in a job sort of in your field? Like what do you look for? What is helpful personality wise, interest wise, skill wise?
It's always helpful if you can speak in front of others. You can improve your public speaking skills. So we kind of have like two sets of people, we have two departments, but you could take also two sets of people. One's community outreach, one's policy. You could be very introverted and be completely nervous speaking in front of people. And you could be with the policy department, but it's going to kind of pigeonhole you with just really the research and that kind of stuff. We probably then wouldn't feel comfortable you being someone going in front of an elected official. So it really kind of, you got to find what fits for you. But if you've got that skill set in your back pocket, then that just opens you up to more. So that's something that I always encourage people is to try and familiarize yourself with public speaking and the different, tips and tricks, if you will, to make you better at it, and then practice at it, because it's rare that someone just naturally is good at it. Maybe they're unencumbered by embarrassment and they're okay getting in front of people. Well, it doesn't mean they're a good public speaker. It doesn't mean they were effective. They actually got people on their side. People learned something. They wanted to engage with that person. And there's a difference. So I definitely encourage people, if you've got an opportunity for a class or a seminar or something, to engage with that and take the opportunities when they come up.
That's great advice. Other questions, thoughts, ideas? So Jared, you said that you have had somebody reach out about an internship. If someone were interested, just kind of, do we keep an eye on the website and you guys do an announcement for internships slots?
Yeah, I think we should get them posted by the end of this month for summer. Yeah, you can always feel free to reach out too. But yeah, we put them on the website, and then we usually share it on social and on our email list just to make sure people are aware they're out there so that they can help spread the word. And yeah, we'll need policy, which usually is a lot of research. So if that's kind of your thing, you want to dig in on policy, that'll be available. Community outreach will be available. So that would be helping like go to table events, interact with the public, that kind of thing. I know we'll also be doing, if you're curious about fundraising and development for nonprofits, we'll have some internships from that too. So if that's something you're interested in. So that would be engaging with our current followers and doing some data entry, helping us with fundraising events and that kind of stuff.
I think Jaden's got a follow-up question, or got another question.
Okay, I did have a question. Hi, my name is Jaden. And so when I was perusing like your website, on the internship, like URL drop down part, it says like the GIS summer internship. That's the only position. And then it also says to see like the careers, like drop down, like click page. But when you click it, it's empty and it doesn't let you go into there. Is it because that you have nothing posted on there? Or is there supposed to be something on there that I could see?
Yeah, there's just nothing posted yet. I
Okay.
think, yeah, the GIS one we've been trying for a while. We're trying to get lucky and see if we can get an intern who knows how to use GIS because there's lots of mapping that we like to do when we can. We haven't had any luck for a while. I think we posted that last fall and this past spring, and we didn't get lucky with anyone who had that background, but we still have it up there. So if any of you know if I map how to use GIS, we'd love to have you help out. And we provide stipends. I don't think I made that clear. So I think it's 1,000 for the spring, 800 for summer, 800 for fall. I think it's just because typically when people start to finish, the spring is a longer semester, so they're with us longer versus the summer and fall. And then if there's paperwork or anything else you need to fill out to receive any kind of class credit or hours, that's something that we can do too without any problem. We'll sign pretty much whatever you need, assuming that you actually follow through with the work that you're doing.
That's great. Yeah, GIS is definitely a hot skill these days. And it's funny, I had that thought when you were talking about the people not knowing that there might be like toxic materials where they live. And it did make me think about like apps and maps and things that are easily accessible where somebody, before they bought a house or if they own a house or are renting, could look up sort of their area. That's interesting. All right, I think we're almost out of time for Jared. Is there anything else that you guys would like to ask before that's out? Thank you so much. We really appreciate it. Round of applause, lots of thank yous in the chat. Very interesting. All right, so we're going to say goodbye to Jared. I'm going to pause the recording.
Thank
My
you all.
students stay on for a second. Thanks, Jared. Bye. Hello and welcome back to our next speaker for the Careers in Public Health speaker series. Our next speaker is Hope Cherry, and she is with the SIU School of Medicine. And I think I might have to have, Hope, I might have to have you tell your title. I know it's Family and Community Medicine, I believe, but I'm not sure what your current title is. So I'm going to go ahead and turn the floor over to Hope to talk a little bit about what she does, kind of her career path and advice that she has for us. Hope, are you on? Let's give her a second because she joined twice. I think she might be having tech problems. All right, let's give her a minute to get started. So yeah, Daniel, she's not speaking yet. So we'll wait just a second. I saw your chat message. I'm going to pause the recording since we won't start until she's speaking. Go ahead and get started. Okay, welcome back. We have our second speaker of the Public Health, Careers in Public Health series. Today with us, we have Hope Cherry. And Hope is an instructor with the Family Medicine program at SIU School of Medicine. So I'm going to go ahead and turn the floor over to her to speak a little bit about her job path and careers that she's had and advice that she has for other people's careers.
All right, well, thank you guys. Hopefully it's working this time. Hopefully you can hear me. So as Dr. Klein said, thank you for that introduction. I'm Hope. I've been now with SIU School of Medicine since 2012, March of 2012. This was really my first career position after graduating. I graduated from your program from your guys' program in 2011. Before it was a public health program, but it was still at that time, very public health focused. I actually interned with SIU School of Medicine before I started working there. I really fell in love with the academic environment, and my career since 2012 has really kind of gone in a lot of different directions. So when I was hired, I thought I was going to be doing what a typical public health educator would be doing. So I really expected to be just a health educator going into the community, doing different projects. And that was half of my job. So, and wrapped with that half of my job was helping medical students to go out to the community and also do community programs. So sometimes that was helping them do some, minor evaluation, looking at needs assessment of our community, making sure that what we're doing actually is something the community needs, and also kind of some follow-up from that too. So helping them do research projects based off their projects that they were doing, or things like that. So kind of the extracurricular side of it. And then the other half of my job when I started was doing medical student education, which was not something I had ever had experience with, and not something that I thought that I would enjoy, but actually it became one of my favorite parts of my job. So of course there is education wrapped in with working with the medical students and talking with them about their projects and going in the community. There's that sort of on the fly sort of education that happens in the moment. And then also helping them do research projects. Obviously, there's education that gets wrapped in with that, but a lot of that is extracurricular education. I also am involved in the curricular side of education. So that just means that the required pieces of medical school, I do have some involvement in the second, third, and fourth years of their required curriculum. So I've really loved both sides. And again, the biggest thing for me is being able to work with medical students has been just one of my favorite parts of my career. When there was opportunities to go in other directions, I said, I don't want to leave the side of education. I really love working with the medical students. So within that 10 plus years, I'm coming up on 11, this is my 11th year here at SIU, I have learned a lot of different things. So grant writing, of course, has been something that I've worked in, of course, programs, doing programs, community programs, and then also doing evaluation for those programs. And then of course, wrapped up with that is the grant writing to get funding for those programs. I've also been involved in some community-based research. I've also been involved in clinical-based research, which is not something that I was super familiar with. I've also been involved in education research. So kind of 3 different areas of research I've gotten to dabble in. I have also had the opportunity to be an administrator for several programs, one of them being a program where I was called Nurse Family Partnership, where I worked with a group of nurses and helped them in the community. They were assigned a case of, basically caseworkers for pregnant, expectant folks and their families. And then also they followed that family through the child's 2nd year. So some really great programs have come out of that. I am now not doing that, but it was a good learning experience. And now I'm an instructor, so I really focus a lot more on the education than I did in the past. So more hardcore into the curriculum. And I also do my other piece of my job I have not given up is help with the extracurricular programs as well. So I'm still working with students. There are 50 plus student organizations on SIU School of Medicine's campus. So I am constantly monitoring that and helping students with those various programs, helping them find small funding or ways to improve their groups as they move forward. So I think that's a little bit about like where I'm at, what I do, but I'm happy to kind of jump into other questions or even explain how the medical school works or anything else.
Okay, questions? You can raise your hand or speak up or put your questions in the chat.
Do you ever do work with medical students, particularly at any point of your job?
Do I work with med students? Is that what you're asking?
Yes, yeah, that's what
Yeah. Yes, yes, I do. Almost every single day I am working with students. So a little bit about what I do. So let me explain the medical school system really quick. So medical school is a little different than like undergrad or other programs. And it's particularly different for the for SIU School of Medicine. So our first year medical students start in Carbondale and they do their first year of school in Carbondale. And then they come to Springfield for years 2, 3, and 4. So I primarily work with the 2nd through 4th years and I'll kind of jump into what that looks like. But I have had some interaction with the first years, but again, the distance is a little difficult to get involved with them. There are some extracurricular projects I do with the first years, but my involvement with them is pretty minimal. But for the 2nd year, so there's 2 ways that I'm involved with students. So one way is the actual teaching the hardcore curriculum. So that might be occasionally doing lectures, that might be doing grading assignments. So for students that take a course of mine, I would, prepare the materials. Most of my classes, so the way that classes are set up, it's not like you get a semester of a class in medical school. You get more of like maybe a week of a class. So it's a lot of information being thrown at them. So they might take a class on service learning, and then they might take a class for a week on oral health. And so my job would be to like prepare that information. They take the course and then I evaluate them from there. And I do that basically, it's pretty similar across years 2, 3, and 4, where I do a lot of preparing materials, teaching the students, maybe doing lectures, maybe just doing self-study for them, and then doing like essentially grading their work. Medical school's not like undergrad where you get like a grade. So most students, it's a pass fail. So unless you're a really terrible medical student, you're eventually going to graduate from medical school. So that's like my one hardcore curriculum piece. And then on the other side, I am constantly working with students on their different projects. There's 2 that I'll mention. So one of them, and these are extracurricular. So that means the students they do it because they want to do it. They enjoy it. They don't get credit for the work. So the 2 examples I'll give, one is called student hotspotting, where we take a group of students. So that includes medical students, but also students from other universities as well. So we work with University of Illinois Springfield. We work with St. John's College of Nursing. We've worked with Lincoln Land Community College. We've worked with SIUE for the pharmacy program. So a lot of different schools are involved in this program. But basically, we take a group of interdisciplinary students and they're assigned to a patient, and that team works with that patient for the whole year. And so a lot of that is helping facilitate with students working with that patient. And I can talk a lot about student hotspotting, but basically I just make sure that students are, doing good work, taking care of their patient, communicating with their patient, etc. And then the other like program that I'm highly involved with, again, students don't get any credit for this, but each year we do a day of service for our community. We call it in our like medical backyard. It's like literally the neighborhoods that are between the 2 hospitals and behind the medical school. We do service projects in that neighborhood. And I would say probably 75 to 80% of the medical students come out and volunteer on that day. And that is not necessarily like health. I mean, it is health related. The students always think that they're going to come and do like blood pressures or vaccine clinics, and that's a great thing. But like the day of service, we typically do simple things like raking up the community park, or picking up trash from the alleys or things like that. So, but I always tell my students too that end up in volunteering for this. I always say it matters where you live. So, you know, the neighborhood that you're helping with today is you're impacting their health. So those are just two examples of some of the projects that I do that are extracurricular with students. But yeah, I would say on a daily basis, regularly, you know, or multiple times a day, I'm communicating and working with students. Sorry, that was a long-winded answer, but yes. And then I did see a couple of chats. How hard was it getting a job right out of college? You know, I will be honest and say that it took me like 6 months before I got hired. My supervisor was the one that hired me. So my internship supervisor was the one that got me the position. But it is working for the state, and the state moves at snail's pace. So it took them a very long time to get the position out there. So I waited like 6 months before I got to actually apply and be in that position. I would say, you know, I also would say though, I was an exception to the rule in some ways, because I was filling a gap that needed to be filled within the department. So it worked out well for me and my internship to move pretty smoothly, you know, minus the 6-7 months that it took to get the position out there into that job. But there was certainly a lot of learning curve for me. Like I never thought I would like the education side of it. So that definitely took me some time to kind of get my feet under me with that. Do I have any involvement in the PA program? Yes, I've worked with a couple of the PA students through student hotspotting, which I mentioned. I don't teach them outside of that extracurricular program, but they also occasionally have PA students who rotate through our family medicine clinic. So I will occasionally run into them there as well. Do I consider my job a higher level or entry level job? And do I only have my bachelor's degree? Oh, no. I would consider now what I have a higher level job. When I started, the position that they wrote it for did not even require a bachelor's. I now have my master's degree in applied communications with my focus in health communication, which I got from SIUE. And that allowed me to move into my instructor position because an instructor is considered a faculty member. So you can't be a faculty member without at least having a master's degree. But the entry level job was what I started with. And like I said, the position that they wrote it for did not even require me to have a bachelor's degree. It was pretty basic, but I learned a lot on the job. So that's what helped me move forward. Am I aware of any future internship opportunities? So I do take interns from SIUE, usually at least once or two a year. So if you are interested in doing an internship, you can always reach out to me. However, I will say I do already have an intern for this summer, so I can't take anybody for the summertime. But if you are still like working into the fall semester or even spring semester and you would like to intern with SIUE School of Medicine, you can email me and we can make something work. In my job, did I do any grants or programs approved at your job? Do you mean like if it was written in there?
I'm sorry, I was trying to type it, like I was trying to say, like, were there any programs or grants that got implemented? I'm sorry, and I didn't mean to.
No.
I'm sorry.
No, you're good. You're good. So yes, I actually have had a couple different grants and programs that that I have worked on over the years. So one of them being the Nurse Family Partnership. So that one we had to do a huge long, it wasn't technically a grant, but it was a huge long application. We had it was an odd situation. We had the funding provided to us from the community. So we basically had to just write the application and make sure that we got accepted as a program. So I worked on that and got it up and running and implemented. And no longer, like I said, there's somebody else that's running the program now. I kind of moved on from that, but that was one. I've also, there's been a lot, and some of them actually have been part of my job description at times, and then others have been just other duties as assigned. So an example of one that had been in my job description for a while was one through the Illinois Emergency Management Agency, and it was a grant for radon prevention, or radon detection and prevention of lung cancer. So that one was in my job for a while, and a lot of what I did with that was a lot of just community education, and then also was involved in the grant reporting back. And actually that was one that SIU has had for over 10 years, because we had that grant before I started, and then we've continued to like improve that grant. Again, that was one I had been involved with and have passed it on. There's been a lot of other grants that I've written or helped write that have not specifically been on my job description. Some of them were ones that I wanted to do personally. Like there was a grant that I wrote for through the American Psychiatric Association that was for doing improv. This sounds really weird, but doing improv with individuals who are in the juvenile detention system. So we were using improvisational theater to help them become better communicators. And so that program lasted, it was a pilot program, so it only lasted like a couple months. I think it was like a spring semester we implemented it and then had to report back on it. There was another one that I had written when I very first started. My very first grant was like $800. I was so proud of myself. I was like, $800. And I used my money to kickstart one of my classes that I teach on pregnancy and childbirth. So I was really interested in that topic, and I just needed some extra funds to kind of get my class started. And most of the $800 went towards that. So yeah, those are a few of my like grants and programs that I've done throughout the years.
It's interesting that you're talking a little bit about like maternal health. And I know there are several of the seniors here today who are interested in maternal health, infant health, particularly for Black women and women of color, in general. So it's interesting to hear that, that is kind of, because you're talking to the source. I mean, you can educate future doctors. And I think that's where a lot of the frustration is, when a woman of color comes in, with pregnancy or complications, and how their pain may be ignored, and, all of that. I think that's a really big issue. And I love the idea that you've been able to kind of get at the source. So is that something that you guys address in the med, like in some of the stuff that you do?
Oh yeah. I've actually written that into that. I have on my class that I'm still teaching. I started that back in like 13 or 14, and I still teach that class every year. I have included a lot of, I include like a whole day of articles, sections out of a book, and videos and things that all center around the history of maternal health in the United States, and specifically with people of color, and how those two paths sort of deviated, and also how basically the provider without, I mean, I could talk about birth for like ever, so don't get me started, but basically how women of color, their providers, which were primarily Black midwives, were chased out of practice. And so I kind of talk about how we've not just lost like the trust, they've not just lost trust of the system, but they've also lost the cultural aspect that was really important to having, healthy, to really encouraging health within their own culture. So we talk a lot about that. Again, I could talk about birth forever, so I don't want to jump too far into that. One other thing I did want to mention that's kind of a pivot, because I work for an academic institution, there are other kind of career paths within public health that you could do within a medical school. So I'm kind of I've kind of journeyed doing a lot of different things. Like I've done the program side, I've done the education side, but there are individuals who have either a bachelor's in public health or who have master's or PhD, who they do a couple different things. So I know several who do just community programs, and they do grant writing and evaluation just for their community programs. And they don't necessarily work with medical students a lot. Most of their education is just in the community. And then I also know several who work in the clinical research side of it. So they do like population health, but then they also do like clinical research. They do like across the different clinics, they look at a particular health topics, and then they do research based on that. And then there's other ones who do population-based research. So they look at a community outside of the clinic setting and they do research based on that. And then there's also folks who work just in the education sector. And so they really are only working with medical students, sometimes working with the medical residents, but mostly with med students. And their focus is just teaching med students. So they don't really do the program side of it. They don't do the research side. They really just focus on the teaching. So I kind of like what I do because I have a little tiny bit of everything, but I would say there is definitely avenues to pursue those kind of different areas within academics. So.
That's really good to hear. I mean, especially with sort of more the entry level or more with a bachelor's degree. Yeah. So if you're interested in positions potentially with the medical school, this is great information to have and a great resource to have. And I believe like the School of Medicine has their own like portal for hiring and like job announcements and okay.
Yes. Yeah. And I would say too, as with any job, I always think of it really depends on where you work. I think that a lot of times if you work for a really good institution, it doesn't necessarily matter what you initially get in doing, as long as that environment is supportive of career growth, which I feel like that's how I feel about SIU School of Medicine. Like they do a lot with like paying for people to go back and get an additional degree, or there's a lot of internal training with SIU as well. So like if you wanted to learn more about research, or if you wanted to learn more about a lot of different things, there's education that happens internally as well. Actually, I'm involved in a research track right now for med ed research. So I'm doing like I didn't want to do this. I don't know. I did want to do it, but it feels like going back to school, honestly. Like it feels like going back to grad school because I'm basically writing another research paper and doing a ton of like, I did a huge lit review and I had to like come up with all my research questions, and I had to do that for my grad degree, which was like very good, but it also, I like research. I like doing the med ed research because it doesn't feel as like, I don't know. I feel like I'm getting something out of it. Like I'm giving back to the students still by doing medical education research, but research is still like not my first love. It's going to help me, and that's why I'm doing it. But that's just one example of like, I would not have had that opportunity to get the additional training in research if I didn't work for SIU. So find a good institution that cares about your forward progress. And it doesn't matter if it's entry, if it's just working a secretary job at the clinic, you're getting a lot of, it's also like what you put into it is what you can get out of it. Like I see a lot of people who have a great understanding of the healthcare system and they're just the front desk person, but they are seeing what healthcare looks like. They're understanding like, you know, aspects of population health just by being there and interacting with people. So yeah, I know that's kind of like sort of meta and vague, but I feel like there's always room to grow if you're at a good place.
That's great advice. I mean, just to, getting in someplace and then you're sort of internal at that point and you can have all these other opportunities. So that's great advice. Other questions for Hope? Thoughts or questions that we have? We probably have time for like one more. Anything else? Okay, this has been very helpful. Yeah, anything you want to leave them with?
Yeah, I would just say if anybody has any questions about healthcare or healthcare education, it's kind of what I've grown to really love and understand. So even if you're not considering medical school, but you want to do like nursing, or if you're like, I want to do something with healthcare administration, feel free to reach out to me. I'd love to chat more with you. If you ever want to talk more about pregnancy and childbirth, that also is one of my favorite topics. So actually, and I'll say too, if you are interested in any type of clinical involvement with moms and babies, Illinois, not that everybody's going to end up in Illinois, but Illinois has is passing a a licensure for certified professional midwives, which is actually an easier track than the certified nurse midwife because you don't have to be a nurse first. So if you really would love to, work with moms and babies, but you don't want to do nursing school, check out certified professional midwifery. It's still in like the rules section at the state level, but hopefully within the year they'll have the licensure out.
That's interesting. How long is the training for that? Do you know? You do it
It depends. The closest school for midwifery is in Wisconsin, and I think it's a 2-year program. But then that also, you have to get so many births in within your training. So it could be 3 years if you don't get all of your like birth and prenatals and postpartum visits. So again, I could talk about birth forever. So that's just my little plug. If anybody wants to know more, I would love to talk with you more about it. So
That's excellent. Thank you so much, Hope. We really appreciate it. All right, let's give Hope a round of applause.
thank you, everybody. Have a great rest of your day.
Bye, Hope. Okay, welcome back, everyone, to the Careers in Public Health speaker series. And I am very pleased to have our final speaker for the semester and for the third of this series to be Nicole Holmes. Nicole is the Manager of Health Equity for the National Alliance of State and Territorial AIDS Directors. Did I get that right? I've been working on it. And we've asked her to come here to really, speak about her experience, her advice that she has for us. She has a great and interesting, career story. So I'm just going to go ahead and turn it over to Nicole. Welcome. Thank you.
Thank you so much for having me. I kind of lost count about how many times I've done this particular speaking session, but I am glad to be here. Dr. Klein, I'm gonna go ahead and let you know I appreciate your efforts, but we have been fully going by NASTAD since 2016. So I appreciate you giving the acronym, but we do these days go by NASTAD. And because I am who I am as a person, links-wise, resource-wise, I'm actually gonna be dropping links in the chat basically the entire time. So that's one of the first ones. Let me get you all a working link. Let's see. So I do currently work for NASTAD. I'm actually on a team of managers of health equity. So what NASTAD is it's a membership-based national HIV nonprofit. We do kind of operate through many federal guidelines because that's where some of our funding comes from. I will tell you that I am, and Dr. Klein's probably heard this about 8 or 9 times already, I am a one-trick pony in many ways. With the exception of one internship I had in undergrad, pretty much my entire, what used to be a resume is now a CV, is exclusively all sexual health, whether it be sex education, whether it be more of the admin work that I'm doing nowadays with capacity building and technical assistance, you name it, I've done it. I have experience as far as reproductive health and justice as well. So any questions that you have as far as pretty much any realm of sex education, I'd be more than happy to answer those questions for you. I am also published, so I do have a publication with Dr. Lauren Beach from Northwestern University, and it is about bisexual health. So basically, matter of fact, it's a perfect time to talk about this because March is Bisexual Health Month. So this paper is basically, it was formulated out of my former career, which was with Center on Halstead, which is the Midwest's largest and most comprehensive LGBTQ community center that is based out of Chicago. And that link is also coming in hot. And what I did there, I worked there for 5.5 years. At one point, I was an HIV tester. The role that I had before I left was managing the state of Illinois HIV and STD hotline. I also managed a newer program of ours at the time when I left, which was the HIV Resource Hub. So basically, in 2019, we started working with AIDS Foundation of Chicago on funding that we both applied for through the Chicago Department of Public Health. And that funding was going to be basically to develop a program where you could be a one-stop location for people that are living with HIV. So essentially, if you were in need of linkage to housing, linkage to food banks, linkage to pretty much anything that you can think of, because that is something that is emerging within public health, is trying to focus on the total health beyond just focusing on wellness. What can we do outside of here's how to prevent? But we actually, it still is prevention. It's just kind of thinking outside the box in ways that we can prevent. So we started visiting various health organizations in the Chicagoland area so that we could launch this program. And our official launch date was supposed to be February 14th, 2020. So you can imagine what happened a month later. So we basically had to shift gears and become a one-stop location for people who were either living with HIV or people who were HIV negative and on a medication that's known as PrEP, which is pre-exposure prophylaxis. What we were able to do for them is if they called the number that we had established to be able to do the original purpose, and if they had lost wages due to COVID, and we were really expansive with that definition. So let's say lost wages due to COVID meant that you were laid off as a result of COVID. We helped a lot of taxi, Lyft, and Uber drivers because they weren't getting as many rides, of course, because people were in the house. We were able to help someone who took some of their money and put it towards helping to bury a relative that had passed from COVID, which is a loss of wages due directly to COVID. And basically, we were able to help people with $200 grocery gift cards until we ran out of those. We were able to help folks with rental assistance. If you were HIV negative and taking PrEP, I think we were able to help you with 1 month up to $1,500. And then if you were living with HIV, we're actually able to help you 3 months up to $1,500 each time. In addition to being able to help people with their utilities, including phone and internet. By the end of that program, we pretty much went until, I want to say, December 2021 to really help people be able to recover in the best way that they could. We were looking at about maybe $600,000 worth of relief that we were able to provide to people, not only in Chicago, but the counties that kind of collar the Chicagoland area. So I did drop that in the chat as well. So that was what I was doing prior to working at NASTAD. And one of the key I'd say one of the key premises of that program was that there's no wrong door. So there's no wrong door. You should be able to go to your food bank, and even though they may not know the full program, they should be able to be linked to our program. So that was a big key. And thankfully, I was able to take some key pieces of that program and be able to move it over to some of the work that I'm doing now with NASTAD. So a little bit about what I'm doing now. So I'm a manager of health equity. What that meant when I was hired is actually entirely different from what it means now. So what I was doing at that time and what was able to help me get the job was some of the connections that I had to Chicago, because they were working with Howard Brown Health, which is an LGBTQ federally qualified health center that is based in Chicago. And also through my connections with Northwestern University. Those were literally both two organizations that were written in the job description. So when I applied, I was like, oh, well, this is me all the way. So originally what we were doing was ending a HRSA program, which is a Center for Innovation and Engagement. So I came in on the tail end of a 4-year program where my colleagues have been working with folks from Northwestern, working with folks from Howard Brown to put together this compendium of evidence-informed. I'm sure y'all may be familiar with evidence-based, but maybe not as much with evidence-informed interventions to support linkage. And then once that ended, we kind of had to shift gears as far as health equity was concerned at NASTAD. And with that, I want to have a moment of transparency here. So I'm all good as far as like my position at NASTAD, but right now our health equity team is kind of spread doing work under the different umbrellas of NASTAD. So we have teams such as policy and legislative affairs. We have a team that is called drug user health. We have a team that is just about viral hepatitis. We have a prevention team. And we have other teams that are doing work at NASTAD as well. And then health equity is its own team too. And then we also have a health systems integration team. So most of my work now does come through the health and system integration side. And I wanted to have that conversation with you all because just letting you know, I've worked in nonprofit pretty much my entire adult life. So keeping that in mind, that in some places, it depends on which nonprofit you work for as far as what funding may mean as far as your role is concerned. And sometimes that even goes into salary as well, about how much you can or cannot be paid. I will say a little public health hack for you. Even if it is remote, if you are to go for a job within the DMV area, they tend to pay higher because they have a higher cost of living. I now live in Alexandria, Virginia. I did not have to move here. I chose to because currently, although we still have our brick and mortar space, NASTAD is fully remote. Matter of fact, our deputy executive director lives in like Austin, Texas. So we're pretty much spread out throughout the country. We've got a lot of people in the DMV. We have folks that are living in Florida, New Orleans, Los Angeles, Chicago. There are people all over the place as far as NASTAD is concerned. So some of the work that I'm doing now, most of my work is actually with our health systems integration team. And what we've been doing is kind of taking some key pieces from that HIV resource hub. DMV, thank you. That'll actually be DC, Maryland, and Virginia. That's not the Department of Motor Vehicles. Thank you for that. You'd be surprised how many people were not aware of that, but thank you for asking. And the reason it's called the DMV is because actually DC happens to be nestled kind of in between Maryland and Virginia. There are times where you can like get to Maryland or get to Virginia without having to go through DC. But for the most part, you would have to go through DC or right next to it at some point to get there. And since I know some of the other speakers earlier have made some mentions about policy, I just wanted to point this out for you all. One of NASTAD's key programs is actually doing Hill visits, and the folks on the legislative team are going to be doing that in May. So just based on our address alone, we have the very fortunate, we have the privilege of being very close to the Capitol. Matter of fact, our address is 444 Capitol Street Northwest. So we're in the Hall of States building with C-SPAN, MSNBC, and Fox News. And basically you can see the Capitol is literally right there across the street from us. So going back to NASTAD being membership-based, what that means is folks in all 50 states, as well as the territories and CDC-funded jurisdictions, we have members. So that would be, let's take Illinois, for example. So I'm not sure if y'all know Andrea Perez from the Illinois Department of Public Health, but she's the current HIV section chief. She's one of the members. And then since Chicago is its own CDC-funded jurisdiction, we also have Dave Kern, who is the I don't know his official title, but I believe it is section chief for the Chicago Department of Public Health. So those are the folks that represent the membership of NASTAD. We have 2 meetings a year where folks convene in DC, and then some do attend virtually, where those members can receive their updates from NASTAD. That's where they go and make their Hill visits. Our next meeting is in May. So they're going to be coming out to make their Hill visits in May to essentially speak directly with our legislators to talk about funding that is needed for HIV programs, as well as, like I said, drug user health, viral hepatitis. So essentially, and health systems integration. So it's all connected as far as what we will be discussing with the legislators, but that is an opportunity that folks do have with NASTAD. Something else that I wanted to bring up to you all is, oh, I'm sorry, I keep saying I'm going to talk about this and I didn't. So what I'm doing now with the health systems integration team, I was able to take a key piece of the resource hub and put it with a new program that we're working on called Building Resource Networks. So essentially, if y'all are not familiar with EHE, which is ending the HIV epidemic in the United States, I'm dropping a link now to kind of help folks get an idea of what EHE is. It is essentially the current federal plan to help end HIV in the United States. And the goal is to drastically reduce new cases of HIV by 2030, especially in prioritized populations and jurisdictions. So there's certain states, for example, let's say Arkansas, for example. The entire state of Arkansas is one jurisdiction. In Illinois, Cook County is its own jurisdiction. So you have some states that are not on there at all, and then you have other states that are fully, their entire state is included in the program based on their HIV rates. So what we're doing currently is traveling to different jurisdictions and speaking directly with them about how can we make a link between the health departments and their traditional CBO partners, and CBO being community-based organizations. So you're thinking your ASOs, aid service organizations, essentially your housing organizations, those will be considered traditional. Your non-traditional would be places like your food banks, your faith-based communities. So basically, how can we make those connections together for folks to be able to end the HIV epidemic together? And we're focusing on those who have the end of the HIV epidemic funding. So we're helping them spend down their dollars through these activities. And one of the things I love about my role at NASTAD is that I have, well, it depends on the time of the year. I love it. And then sometimes I'm like, I have experienced a lot of travel. This year alone, I have traveled to Little Rock, Arkansas, as well as Dallas. Next week, I will be going to Louisville, Kentucky. At some point this year, I will also be going to Atlanta to speak on at a conference for some of the work that we have done. And that's just everything that I can think of right now, because there's also some times where folks will travel to DC. So I have 2 of those events coming up as well. So there's a lot of travel involved with this role, but I am single with no kids. So that's one of my favorite parts about the role, is to be able to get back out there and kind of do the work in a way where I'm able to sit. Not that I don't enjoy this, because me being able to talk to you all from Virginia is thanks to being able to have virtual spaces, but it is nice to be able to sit across from folks and to get an idea in person about what is going on. And honestly, that's still one of the best ways to establish rapport and trust in this field. Something else that we are focusing on within not only NASTAD, but just health equity in general is neuroscience and trauma-informed approaches. So neuroscience stands for neurobiology, epigenetics, adverse childhood experiences, and resilience. And basically it is a holistic understanding of how trauma and resilience impacts health outcomes. And I did drop that in the chat as well. And I know some folks are familiar with trauma-informed approaches, but something else we're trying to focus on at NASTAD to try to make sure we're being as innovative as possible is to focus on healing center practices as well in NASTAD. So trying to shift from trauma-informed care, so we don't want to fully drop it yet, but going into healing-informed as well, or healing-centered as well, rather. I know that I said that I am a one-trick pony as far as HIV and sexual health is concerned, and I still am, but I've had opportunities to grow and shine in other ways working with NASTAD. For example, I recently had an opportunity to get into workplace wellness. So I developed a presentation that was called Compassion in the Workplace, and it kind of talks a bit about trauma, it kind of talks about neuroscience, it talks about what it means to practice compassion, because coming from frontline work, I can tell you all day all the stories of worked with this client as they were crying, and, you know, like those kinds of stories. But we don't really have that same compassion when it is now week 3 of a project that is due next week in week 4, and you are not hearing from people, and you never know. So just keeping in mind that you never know what folks have going on, and practicing that compassion in the workplace not only allows for a more cohesive workplace, both with internal and external partners, but it also adds to the richness of the programs when you have that additional sense of trust among the people that you work with. So that presentation was actually something that my boss asked me to put together, I want to say in May of 2022. And since then, I have presented it 4 times, once for NASTAD staff, once at a conference, once at an in-person, and at 2 trainings for NASTAD member states. And I think I'm going to be presenting it pretty soon, within the next 2 or 3 months as well. So just the fact that that one presentation has almost become like my signature piece at NASTAD is very interesting, because there's literally no exact mention of HIV and STDs, but I can still take my work from over the years and place it within that particular work. Something else that I wanted to mention that I did while in undergrad was that I was involved with my standard internship as graduation requirements, which was with MADCAP, which is Madison County AIDS Program. But I also, because I am me as a person and just very extra, I took on a second internship in 2014, actually before I did the one that met my graduation requirements. And this one is through Morehouse College, which is a historically Black college in Atlanta, Georgia. They have what's called the Project MOTEP, which is through the CDC CUPS program, which is CDC Undergraduate Public Health Scholars Program. So what I was able to do with this program, and this is focusing on minority students, was to I got to stay at Morehouse College's campus for maybe 3 or 4 weeks. After that, I flew out to Cincinnati and worked with the National Institutes of Occupational Safety and Health. Like I said, that is the one thing on my resume that is not sexual health. And believe you me, I begged to stay in Georgia and work with the Georgia Department of Public Health on the HIV program. But it was nice for me to be able to go and work within a government institution and learn very quickly that it was not for me, but it was nice to have the experience. So with that in mind, I can go ahead and stop now and ask if anyone has any additional questions about things that I have done within the field. Like I said, I have a background in reproductive health and justice as well. I have served on the board for 2 abortion justice organizations. I have taught sexual health using an organization's curriculum that I was working part-time with. I've also done contract work where, using Advocate for Youth's 3 R's curriculum, which is rights, respect, and responsibility, I actually was able to fuse that into my own curriculum and also teach sexual health. So I can talk to you about sexual health from both of those sides. And then just this last piece about some work that I've done at both Central Halstead and NASTAD. So I'm sure you all have heard within your classes, or just like kind of buzzing around the public health field, or even university in general, about DEI, which is diversity, equity, and inclusion. Some people add belonging to it as well. At Central Halstead, I was one of the co-chairs for their DEI group. And currently at NASTAD, I'm the co-chair. We actually don't have a DEI group. We're trying to focus directly on anti-racism. So we have an anti-racism work group. So with that work, we've been able to externally and internally do some really awesome work, such as we are revamping our HR handbook currently. Of course, there's some things that have to legally be in there because of human resources, but we are revamping all the language that we can, revising our policies just to make sure that they are coming from an anti-racism lens. So with that in mind, I'm going to mute myself now and open the floor for any questions or comments.
Okay, questions and comments, you can put them in the chat, you can raise your hand, or you can just speak out.
For Morehouse, were there any, I actually am quite interested in what you did there. I was just wondering, are they still accepting interns? And I was just wondering if you had any extra information on that, because that's really interesting. And I do have family in Atlanta, Georgia, so I would be able to access that. So I was just wondering.
Oh, that was actually the most, oh, thank you for the question. That was the most recent link that I put in the chat, but I'm happy to send that to you personally as well. So I believe that that is, so currently for this year, they're all set as far as their interns. So they do take juniors, seniors, and recent grads as well. So even if not this cycle, definitely thinking about the next cycle as well. And I had some really cool opportunities come from that. For example, I'm still, even though I did not do any, even though I did not get to work with the Georgia Department of Public Health with their sexual health department, I'm still in touch to this day with the person that runs that department because I made sure to speak to her. And while we were all meeting together with everyone's mentors and such, we're still in touch to this day. I got to present some work from NIOSH at Abrahams, which let me get that conference name because I definitely forgot that acronym. ABRCAMS being the Annual Biomedical Research Conference for Minority Students. There we go. Ooh, I am having something happen with my, okay, I'm sorry, I don't know what just happened, but I'm sending in ABRCAMS as well. So I see we have a question from Alexis.
Yeah, so I had a question. So because I don't really know what I want to do you think that before you got, like you said you had 2 internships, right? Do you think that whenever you got, I assume, did you get your NASTAD job after your second internship?
Oh, I've only been with NASTAD since July 2021. Before that, I was with Central Halstead. So I will say that sexual health is something that I knew in some capacity that I've wanted to do since high school. When I first got to SIUE, I actually didn't even know about the health education program. I thought that I was going to be counseling teens about sex and sexuality. So I came in to SIUE because I was like, oh, let's do the counseling program. I had my first meeting with my advisor and I got there early and I was kind of bored. So I started looking at the big wall of, I believe it was like white and yellow at that time, sheets that were just talking about different majors. And I was like, oh, health education, what are you? I picked it up, read it, gave it to my advisor, did not look back. I would say your best bet as far as trying to figure out what works for you is, and I'm not fully encouraging this, but the work that kind of speaks to you that you would be glad to do if you weren't getting paid for. You should be. I want to make that clear. You should be. But the work that speaks to you as far as this is something that kind of ignites inside of me, because I'm sure by now y'all have definitely learned about the diversity in public health and what you can really do with a public health degree, I really can't think of a single industry that is not in some way affected directly or indirectly by public health. So I would definitely think about when you are reading articles, when you are watching the news, just think about what speaks to you. And then I would say go back to your classes and see where you can kind of pull the public health out of that, if that makes sense.
I also did have another question though, that because you did your second internship, that gave you a little bit more experience for like other jobs to like hire you, would you say?
Well, I would say it was a bit, a bit difficult when I graduated. I graduated officially in August, although they let me walk in May, and I did not get my first job until November, which I know sounds like a really short time, but when you are sitting fully in, I've done all this work, like when you are sitting firmly in that, it is pretty difficult, but it took for Central Halstead to really take a chance with me because I was so young, going directly into the work. So, and I don't want that to discourage anyone. I'm just, being open and honest about the story. Don't be afraid of volunteer work too. Once again, y'all should absolutely be getting paid. But by the time I graduated from undergrad, I had maybe a resume that was like 3 or 4 pages of just volunteer work, internships. Like it was, I had the opportunity as a senior to teach first-year students in sexual health classes. So forever grateful to SIUE for all the experiences that I was able to bring with me and kind of still pull from today. Haley, you have a question? I'm sorry, Alexis, before we move on, were those your questions? Are you all good? Okay. Haley.
Hi. So I've been looking for an internship because I'm doing mine in the summertime, and I'm
Mhm.
doing mine. I don't know if are familiar with like Illinois, like Effingham, Illinois area. But that's where I'm looking mostly. And I've looked at some like nonprofit organizations kind of within that area. And so I
Mhm.
know you mentioned nonprofit, but could you go more into like I'm thinking like pay, because like I'm also thinking about an internship that's like with the hospital. It's like healthy communities. And so I just didn't know like much about nonprofits and like their pay and like how that works. So I didn't know if you had any more information about that.
Oh, I fully believe in pay transparency. I have no problem answering that question. So when I was managing the state of Illinois HIV and STD hotline in Chicago, I was making about 49,000. Currently, I make 72, which is pretty high in our field. Having said that, that's why I'm trying to give y'all that hack about even if you work remotely, DMV, they just happen to. I just wanted to throw that out there. So it depends on the work that you're doing and what nonprofit you are like what nonprofit you're working for. So essentially, a really good way to know or to even gauge what the salary may look like is if you look at some of the nonprofit tax documents, because they typically show you what the 5 top earners are making within the organization. And even you can use websites like Indeed or even job websites and general public health career websites, because that will at least give you a list of websites that you can go through, a list of organizations that you can go through, even if you're not currently looking for a job, just to see what internship opportunities they have available. So I do hope that that does help. I know it's not specific to Effingham, but I do hope that does help.
No, that does. Thank you. And thank you for sharing that information.
You are welcome.
Other questions? You can tell you have a great resource right here. Lots of experience, lots of passion, and just you can tell you love what you do, Nicole, and you got that like wide view and connections. Like it's clear you're connecting this with this over here. And yeah, I love hearing your passion. I know I've heard you speak a lot and I just love it. I think it's great. I hope we all feel about our jobs the way that you feel about yours and all the good that you're doing right now, especially with like the trans health stuff that we're seeing now. Oy.
Oh, I'm so glad you brought that up. So at our last meeting, we had a meeting in October where basically we call it a meeting, but it is set up like a conference because it does have plenaries, it does have breakout sessions, but it is also a meeting where members specifically are receiving information from NASTAD. So that's why it falls more into the meeting category. Our last one, we actually talked about the politicization of public health practice. So we had open conversations about trans health. We had open conversations about legislation. We talked about sex worker rights. We talked about abortion. We talked about Black maternal and pregnant parent health in general. And it was a really great discussion. And mind you, NASTAD really doesn't have that wide of a reproductive health. Like we don't have a reproductive health arm, but we do have folks within the organization that are either directly or indirectly involved with volunteer reproductive health work. We have somebody that used to work for our organization that does a diaper drive every year for Mama Toto Village, which is an organization in DC that is focused on essentially providing resources to parents, especially in lower income areas within DC, for newborn babies, for babies up until about maybe 2 or 3 years old. So just have an opportunity to work with folks that are doing that like awesome work. I love it so much. Another thing I wanted to add, when you are going through your various websites, really look into the benefits. That's probably one of my favorite things about the job that I have. We have benefits such as starting from the 4th of July until Labor Day, we're off every Friday. And that's not a 10-hour 4 days a week thing. We just work our 8 hours those other 4 days and we are off on Fridays. One of my issues I had with my salary in Chicago was not even the price itself. Yes, it was low, but what I was paying for healthcare at that job versus this one. So at that job, I think I was paying maybe like $137 maybe a month or a check for healthcare. And currently I have Blue Cross Blue Shield PPO and I pay about $56 a month. I just got reimbursed. I'm in grad school, by the way, part-time. I just got reimbursed $4,000 for my grad school program. So really look into benefits as well, because sometimes, depending on what the benefits are, they can kind of make up a difference if they are really adding to your life in that great way. I also have lots of PTO. So those are some of the things to think about when you're also looking for an organization that you want to work with as well.
That's great advice. Yeah, consider the whole package. And I know it can be a little intimidating, or just like Nicole has done so much and so much passion and so many, while focused. I mean, like you call yourself a one-trick pony, but that is quite a pony, you know. So just understand, like, she started where you are also. Okay. So Nicole had a beginning, you have a beginning too. And you know, so try not to just, you know, be inspired, but don't feel like this is something that you know, you potentially couldn't do. You know, she found her passion, and it's amazing.
So speaking of that, I am actually going to send you all one last resource, and this is not even directly related to public health. This is just speaking to you all as future folks in the workforce. This pony is burnt out because I did so much in undergrad, because I was doing 10 and 12 things at one time. This pony is burnt out. So I just put a link into the chat. It's called the NAT Ministry. So it's an organization that essentially focuses on rest as resistance. Please rest. Rest. I cannot emphasize that enough. Y'all are in public health. I'm sure y'all have been preached at about sleep health, and not even just sleep, but just rest physically. And if you do not find a time to rest, your body will find a time for you. So that's my last note. But yes, please rest. Like, don't even be impressed by this, because I am sleepy. Like, I'm exhausted because I did so much. So find your niche, but don't be like so excited about it that it kind of takes some of the energy that you have for the rest of your life, because you all are fully realized people. You all are all human beings outside of this work. And I feel like I'm now in a space where I'm really getting to know myself outside of public health, because that was all I knew for years. But please take that as much as you are taking the career advice. Matter of fact, that is the career advice.
I cannot imagine a better way to end this series. That is spectacular advice, you know, on top of great advice. So can we all please say thank you to Nicole? Really appreciate that. Great information. Thank you so much, Nicole. It's great to see you.
Thank you. You all have a great rest of your day and semester, and good luck.
Bye.